Well, hello. My name's Ewen Robertson, and today this is a LifeLink global interview with Helen Watts, who's come over from Birmingham, and we are going to be looking at the whole subject of spiritual well-being and the work that Helen does related to that. So I'm going to ask her some questions. And so, Helen, welcome.
Thank you.
It's great to have you with us.
It's good to be here. Thank you.
Thank you. So can you, to start this interview, just tell us what your job role is, what your title is, and how you came to be involved with this work?
Yeah, so my job title is Senior Chaplain for Wellbeing, working in primary care. So I'm based in a GP surgery, where I see, well, I used to, I now work on the telephone because of the pandemic, but working with one-to-one appointments with patients who are referred by either the GP or other healthcare professionals within the practice for equivalent, I suppose, to counselling sessions, but chaplaincy sessions with me to talk about their well-being. Mm-hmm. And I offer spiritual care, pastoral care, counselling care, if you like, to those patients.
I just want to focus for a moment on this subject of well-being. It's a kind of buzz phrase or word that's come into being over the past few years. But tell me, what do you understand by the term well-being and how it's being used at the moment? Yeah,
it's an interesting one, isn't it? You're right, it has become a buzzword. To me, it speaks about an overarching, integrated sense of peace and welfare within an individual. Mm-hmm. You can also have community well-being, which would be a similar thing. The ancient Hebrews had a word for it. Their word was shalom. This sense of there being peace, contentment, satisfaction, integrity in all areas of life. And so when we're thinking in health context in the NHS about well-being, we're thinking beyond the physical.
Yeah.
So we're acknowledging that people are integrated beings who have lots of parts to ourselves, and it's not only physical. And when people enter the NHS, for example, they don't only come as a collection of symptoms in their body, they come as a whole human being. And so working in well-being is about working with the whole person. I think of it like obviously their physical self, but we also have a cognitive self. I'll explain these terms in a moment. Yeah. An emotional self, a spiritual self. And so as a chaplain for wellbeing, I'm interested in all of that and how it all integrates together, and how I might be able to help a person improve that integration, as it were. So if you think about someone's physical well-being, seems fairly obvious. You're talking about their health, their vitality, their stamina, whether or not they're living with ill health, or whether they're actually quite well and healthy. But it's not all there is to us. So we have this interior life going on as well. So we are cognitive beings. We've been made by God to think. We have thoughts, and our thoughts might be helpful or unhelpful. So sometimes we might have thoughts that might be depressing or difficult or challenging. We might have, from childhood even, taken on a way of thinking which diminishes us in some way, or which makes us fearful, contributes to our understanding the world in a way that perhaps puts us on our guard or makes us defensive. Or we can have very capable problem-solving skills. We do lots and lots of thinking in our life, and the way that we think impacts enormously on our well-being. I think it was Shakespeare who said, there is nothing either good nor bad, but thinking makes it so. As Christians, we don't entirely believe that. We know that some things are just intrinsically good and bad. But actually a lot of our understanding of what's good for us or bad for us is just is just informed by our thoughts. So well-being is I'm interested in how are people thinking? Are their thoughts helping them towards living a life that's integrating their values with their experience, or are their thoughts interrupting that process in some way? And then of course we're emotional as well. That's another part of our created way of, God has made us to be emotional. We don't need to fear being emotional.
Yeah.
We have emotional responses to the world. We have excitement, joy, sorrow, despair, depression, fear, hope. We have all of those emotions going on. Many of them all at once, all in one day. It changes a bit like the British weather. How we're feeling changes a lot. But again, our feelings are contributing to our sense of, are we sitting well in the world? Are we feeling integrated with our values and our hopes? Is it coming together? And well-being is about that bringing it all together. And then, of course, we also know as Christians that we are spiritual beings. Whether or not we have a faith, we are spiritual beings. And we have within us a longing for something that's beyond us. We're longing for the transcendent, a longing for hope. And I think the spiritual needs that I work with in my job are around every human need for love, both to love and be loved, the need for belonging, the need for meaning and purpose, significance. Those needs are spiritual needs in every human being. Sometimes they're expressed in the language of faith, and many times they're not.
Right.
But that doesn't mean that they're not there. It doesn't mean people don't have spiritual needs just because they don't necessarily talk in terms of faith. And so when you think about all of those parts of us, working with well-being, in my experience, is about how do we join it all up. And I often use a little illustration with my hands, if I can maybe show it to people, where I think of one hand being rather like, this is who I know myself to be, my true self, which is maybe it will be about my values. Those might be informed by my faith or my family background or my culture. But there's something about the true me, maybe the me that I as a Christian would say, this is who God has made us to be in terms of our values, our hopes and everything. And this is the journey of our life, the journey we're on, the circumstances we're living through. Our well-being is maximised when the way our life is lived is as close as possible to who we believe our true self to be. But sometimes it's either the choices we've made that open up a little bit of gap, or it's circumstances that have happened to us that cause a little bit of a gap to open up. And you hear people describe this. They say things like, it's just not me. I'm just not, this just isn't really me. This doesn't feel like myself. I'm not myself. And I think that's when this little gap has opened up. And into that gap, down that crack, as it were, well-being falls. And that's when we experience loss of well-being, when something is either happening to us or we're choosing to live a certain way, or experiences have separated us from the sense of just that integration of our spiritual needs, our thoughts and feelings, and our physical sense. It's not quite fitting together. So that's what I think well-being is about. So I'm looking to help people close the gap.
From what you've said, it's quite clear that you have quite a bit of experience around counselling and things, and I know that you also work for a church. Can you tell us a bit about your professional background and how that's helped you, to arrive, or equipped you for this role?
So many years ago, well, most of my adult life I've been in some sort of pastoral role in church leadership in one form or another. And many years ago, I felt that what would be helpful in that work would be to train in counselling. So I completed a degree in counselling, and I worked as a counsellor, as a therapist, in a secular setting for many, many years. And I achieved accreditation with the British Association for Counselling and Psychotherapy. And so I spent many years actually in that world. Often what I encountered in that work was people who had reached a point where they were needing help because there hadn't been anything preventative ahead of, upstream of their crisis to help them cope. And so I began to feel that I'd prefer to do preventative work if I could.
Yes.
And so then I went into training, so I became a trainer, all the while being also in church leadership, so pastoral care work in churches, working obviously with all of life's events, which included, always does, a lot of loss for people, lots of change, as well as celebrating the sort of, the really happy events and moments with people, helping people through crisis. So that goes on a lot in churches. So I was doing that, and preaching and teaching and all that sort of stuff as well. And the training, so training pastors and training church leaders. And then some years ago, it's now about 4 years ago, I heard about this role in a local surgery to be a chaplain for wellbeing. And they were looking for someone with counselling skills and experience, pastoral skills and experience, to provide this service. And I thought, that sounds like me, you know.
Yeah.
And one of the things that I had found difficult about counselling in a secular setting was the humanistic value that I encountered a lot, which basically was saying, within us, we have everything we need. We have what we've got it to make ourselves work well. And I question that because I think actually we don't. We're fallen people and we need God's help. We need God to help us close that gap, get that right. So we need something other than ourselves. If we had it entirely ourselves, we wouldn't need God, and we do, because he made us that way. And that was one of the reasons why I left secular counselling. And then this role, when it came up, offered me an opportunity to include what I deeply believe about those spiritual needs and how they're met with my other skills. And so it just seemed like a perfect fit, actually, for me. And got the job, and lo and behold, it has been a really good fit. It is a good fit for me. Yeah.
That's great. You've talked very well on the subject of well-being generally, and I love that illustration of the potential gap from the true self. But I think it'd be helpful just to if you could expand a bit on what your role involves specifically now. So can you just expand on that a bit?
Yes, of course. So if you sort of picture a typical day in the life of a chaplain for wellbeing, at the moment I'm working on the phone, but it used to be also working face to face. I will receive referrals from the GP, often people who have experienced loss, which could be bereavement, but can also be other kinds of loss. So loss of relationship, loss of self-esteem. Sometimes people come and they're presenting to their GP maybe with symptoms of depression or anxiety, and the GP notices actually there have been losses. They get referred, and then those people come along, and basically my job is to listen to them. So I listen attentively to their story and help them. I kind of see myself as a companion on a journey towards closing that gap, as it were. So what I'm listening for is those phrases like, this just isn't me. I just feel like I've lost my way, or I'm not myself, I haven't been myself for ages. Or where they're feeling separated from people that are significant to them. Maybe there's been a falling out, that kind of thing that has really disrupted their sense of themselves and how they belong and where they fit. And maybe they've lost touch with some of their strengths, some of their resources, whether those are internal or external. And I'm listening for that all the time, and I'm interested in it. So I listen well, and I ask questions that are designed to help, hopefully, build some sense of hope and resilience for people. So using counselling skills, working with patients, and sometimes I can work for a long time with people. So that's one of the joys of the job, actually, that I don't have to be limited. A lot of NHS counselling work is very time limited and very goal focused. It has to be because of the resource limitations. But that's not what everybody needs. Some people need a companion while they just explore, how do I find my way again? And I'm interested in, where does their strength come from? And that's a wonderful question. When you ask someone, where does your strength come from? The answer to that question often really opens up a spiritual conversation. It's a kind of a way into spiritual needs. They might say, oh, it's my children, it's all for my children. That tells me about their capacity for love and their capacity for sacrifice, that maybe they've kind of lost touch with how positive that can be in their life. You know, or they might say, oh, it's my faith, I've always had a faith, and that's really keeping me going. And I'm really interested then in how does it do it? How does that help them? Some people say, well, I used to feel that my strength came from faith, for example. And I'm interested then to explore with them, what happened? You know, where did that go? And of course, for some people, if they're talking about faith, it's not always helpful. So for some people, their faith community that they belong to hasn't been helpful. Maybe it's contributed in some ways to a sense of failure or guilt or shame or frustration or hurt. You know, it's not always positive. And maybe there's scope then for exploring, well, is it God you've fallen out with? Is it the situation? You know, what's happening there? The way of listening is really, really important. What we're listening for really matters. I do listen to problems, I listen to the painful stories, but I'm not really listening so much for that as for the hope. Where are the sources of hope, and how can we reconnect a person with those sources of hope? And you can always find them when you listen. You can, you know. Yes. For example, someone who's experienced maybe a long time of chronic pain, and the doctors would say that, well, there's not a specific diagnosis I can give you, and we're very sorry, but we don't quite know what's causing this pain. And maybe they've had a lot of tests, and they've lived for a long time with chronic pain. It's really interesting. In Birmingham, there's the hospital that deals with chronic pain conditions. There is a chronic pain clinic in the hospitals in Birmingham, and they have a therapy unit specifically because they've worked out that our physical well-being is connected to our emotional well-being, maybe even our spiritual well-being. And so when working with someone with chronic pain, you might discover that actually they've been affected by trauma in their past, or maybe they've been very hurt and let down, and maybe they've become hard of heart in the emotional sense, and maybe they've become, their disappointment has taken over, maybe bitterness has crept in, maybe it's difficult for them to forgive. And I've had a wonderful joy of seeing people think about that in their times in the chaplaincy service and come to a place where they've become able to forgive some people who've really hurt them and seen a release from some of that physical pain as a result. You know, emotional pain and physical pain are often very connected. Or somebody who maybe is really discouraged because they've just never been able to lose weight, you know, and the health professionals are on at them about it and putting them on diets all the time, and they need to, you know, they know it's bad for their heart, they know there's a risk of diabetes, they know all the reasons why maybe to lose weight would be good for them, but they're just not managing to do it. You know, when you listen to a person's story, not every time, but there often can be times where actually there's a need that hasn't been met, often a spiritual or an emotional need that hasn't been met. That the person is doing their absolute best effort to try to meet it, and maybe has discovered that in some way the way they eat, they're attempting to meet a need. I have great compassion for that kind of situation, but sometimes just the opportunity to hear the story, let them tell their whole story, not only their physical health story, opens up a different way to think about it. I recently worked with someone as well who was suffering panic attacks. She was really struggling with anxiety and getting panicky. And the thing that she hadn't talked about was a very traumatic incident that had happened to her in her late teens, and she'd never spoken about it. And somehow in the course of our conversations, she found a trust. She just found a safety to be able to tell me something that had happened. And it was really interesting because just the telling of it reduced the panic.
Yeah. Wow.
Just having someone who was patient enough to hear that story, you know. I like to think of myself as being, you know, sitting in the place of Christ, really, just sitting in the place of Jesus and hearing. Jesus had such compassion on people. He had such patience to hear their stories. And he knew their stories. And when he knew their story, like if you think about the woman at the well, he knew her story and he helped her to tell it.
Yeah.
And she hadn't known how to tell it. This makes me emotional just thinking about it, you know.
Yes.
People have a story to tell, and they when you let them tell it and when you sit with them while they tell it, it can be very transformative, very healing for people.
Right.
So, you know, that's the nature of the work I'm doing, I guess, really, kind of trying to integrate all these parts of ourselves.
Yeah.
Yeah.
As you've been talking, you know, the whole business of really listening, and of course you're trained in that and had a lot of experience in it, but just the value of that really shines
powerful,
through. Yeah.
Really powerful.
Yeah.
And all our patients reflect often on the transformative power of being listened to.
Out of it too, do you find that you have opportunity or are you allowed to either pray with people or, you know, share something of the gospel, you know, our faith or word of testimony? How does that work? Yeah,
absolutely. One of the joys of being called a chaplain for wellbeing is that it's a kind of an in on spiritual things. And I explain to all of my patients that being a chaplain means, I make it very explicit that I'm interested in their spiritual needs as well as all their other needs.
Yeah.
I do have opportunity to speak about my own faith and to speak about coming to God and the place of God in our life experiences. There's a lot of freedom for that. It's a misunderstanding actually to say that professionals can't speak about faith. If I'm asked about my faith, I am at liberty to tell people what it is and to tell people what I believe. I'm not at liberty to say you must believe this too. You know, well, the answer for you will be you must you know, believe what I believe. That would be an abuse of my position. But where I'm asked about my faith and how it helps me, I have a freedom to speak about it. And when I'm interested in people's spirituality and their own faith, that often opens up an opportunity to pray or to read scriptures with people. I work with quite a number of patients who enjoy the fact that we can read scripture together. Sometimes actually even patients who are not from a Christian background at all. And I might say something like, we might be talking about faith already, and I'll say, well, in my faith culture, there's a scripture that says this, you know, for example. I find the Psalms very helpful. People who are depressed or anxious, for example, I might read, and I might ask permission. I'll say, would it be okay with you if I just read something from my scriptures that I think might describe how you're feeling? And then I might read a psalm, and they'll say, wow, I had no idea that was in the Bible, you know, or wow, that sounds exactly how I'm feeling. Or for people who have faith, a Christian faith, but are unsure whether their feelings are acceptable to God. Maybe they're unsure whether it's okay to pray about some of the things they're feeling, particularly if they're finding they're angry or resentful. And again, the Psalms are brilliant because I can read a psalm to someone and I'll say, did you know you can talk to God like this? And many times people say, I had no idea. I did not know I could say that to God. And it's very liberating for them to realise, wow, you know, and they'll go away and they'll come back sometimes and say, you know, I just told God how it is. I just spoke like it is, like it was in that psalm, you know, and it's just been so freeing. So that's lovely. And yes, I do pray with my patients. I ask their permission. Often I begin by saying to them, because I'm a chaplain, I like to carry them on my own prayer list, and I ask them, would that be acceptable? Would it be okay if I put you on my prayer list? And I've never had anyone say no to that. No one's ever said no. And when it's appropriate, it takes a lot of sensitivity, but I might sometimes then go a step further and say, can I pray for you now? And most patients say yes, that would be lovely, you know. Even patients who don't have a Christian faith I work with a lot of people who have a Muslim faith. They have no objection whatsoever to being prayed for. They very much appreciate it. I always explain to them, I'm a Christian and I pray in the name of Jesus. Is that okay? And they always say, yes, that's fine.
Brilliant.
Because I can't pray in any other name.
No.
And if I'm there as a representative of someone who's seeking to help a person integrate for their whole well-being, I can't be then separating my own self. So how I pray is always in the name of Jesus. And interestingly, at the start of the pandemic, actually, I had a patient who just before the pandemic was supposed to be being referred for cancer treatment. And then she'd had a letter to say that her clinic had been cancelled and she wasn't going to get an appointment. And at the end of the session I said, what can I pray for you? She was a Christian. We'd established a rapport already there. I said, what can I pray? And she said, can you just pray that they'll open the clinic? And this was at the big lockdown when the hospital was shut, apart from for COVID. So that's what we asked. And the next time she saw me, which was about a fortnight later, she said, I've been sent an appointment. I'm going next week.
Excellent.
Another patient who couldn't get into a care home to see a loved one and asked me to pray for a way. And that was astonishing because I wasn't in faith that was going to open up, but God did it for her. Wonderful. And there was a way for her. So, yes, it's lovely. And I have seen one or two, not many, but one or two patients come completely fresh to faith in Christ.
Wonderful.
And I've seen many more come back to faith who had lost their connection to God. Many, many people. And often through bereavement, actually, who have lost confidence in God, lost their faith, and then gradually find their way back to trusting Him and knowing that they're loved and accepted and safe with Him again. That's been a real joy,
Wonderful.
Yeah.
It's very interesting that the government is kind of now allowing and or perhaps promoting this service. And so can you tell us a bit about how it's developing kind of nationally and perhaps also, your own part in that?
Yes, of course, yeah. It's really interesting. Just to make the point, we're working with whole person issues. So when we're talking about well-being, that's what we're talking about. Like I said at the beginning, the integrated person. And as you said, it's a buzzword. It's something that everyone's interested in. And the research is showing that the more attention we pay to the whole person when we're seeking to help them with their presenting issues, the better the outcome for them and the better result. And research shows that. So it's not about religious care. It's about whole person care. Well-being care, spiritual care. Guidelines for doctors tell them when they're being trained and when they're coming into practice, in general practice, they're told that in responding to a patient's presenting issues, they need to be aware not only of the physical symptoms, but of the psychological effect, the emotional effect of these things on a person, but they need to take account of that person's social needs, cultural needs, spiritual and faith needs. They need to be holistic in their response, and that's what they're taught and trained and hope to be. But then they have 10 minutes with a patient, and they've got to just sort of get to some sort of diagnosis, make a formulation. They've got to do that. So where doctors are aware this person needs more than I can give them in 10 minutes, then they're starting to look for where are the services that provide that. And spiritual care mechanisms like chaplaincy and general practice is one of those. Right. Another very big one that's opening up at the moment, it's very exciting, is social prescribing. So we're seeing a lot of that. There's a big NHS drive to provide social prescribers, who are people who listen to a person's story and hear all of the needs. What are their housing needs, their financial needs? What are their needs for exercise and connection? Is there a community I can attach them to? Is there an art club they can be connected with? So social prescribers are looking at where are all these avenues, and they've got the time to do that, which GPs don't have. And among those many options is spiritual care. What spiritual needs does this person have? And some of that results in referrals to chaplains. So in my practice, we're there as a standalone, we are the chaplaincy service. In some cases, we are referred to as a branch of social prescribing.
Okay.
Not all services are fully funded by the NHS. So my service, for example, is part funded by the NHS and part through charitable donations. I'm actually employed by a charity which was itself set up by the practice, the surgery that I'm involved in, because they saw 25 years ago this need for holistic care. And many more surgeries now are becoming aware, and because there's been a drive by the government to really encourage social prescribing, I think that opens up more of an opportunity for people to explore their spiritual needs that way. For example, in a nearby borough to ours, through social prescribing, they've been able to appoint a very large number of chaplains for wellbeing. And they're seeing brilliant results as a result of that work. So they're finding a reduction in repeat appointments with GPs, so it's saving GP time in some cases. And other research that I'm aware of that's been done around the country has shown that an intervention from a chaplain for wellbeing in primary care can be as effective cost-wise as well as wellbeing-wise as a course of antidepressants, for example. So the more the research is known about, the better it is for GPs to have confidence.
You know, people have probably been listening to you speaking and thinking, wow, what an opportunity. You know, how could we get involved? So I'm talking specifically now about churches, you know, and individuals, Christians. So if they were interested, you know, what advice would you give to them about how they might think about becoming involved in this kind of work?
I think there's various levels of involvement. So I think if someone's thinking, I'd quite like to be a primary care chaplain, then you really need to have some counselling skills training, some life experience, and I'd recommend the ACGP course. Or a local colleges often run chaplaincy courses, which is the wider arena of chaplaincy. Because chaplaincy has been around for ages, you know, hospitals, hospices, but also in retail, in the fire service, for example, all over the place. So there are chaplaincy courses that you can go on, and this ACGP one is specific to primary care. So you might want to invest in some extra training for yourself, and then you've got to find obviously a GP who wants that service. You can contact the Association for Chaplaincy and General Practice, and they'll help you to find a way in if that's something that you're really interested in. Or if you're a GP who's interested, who's listening to this and thinks, this would be great in my practice, this would really help my patients join up all the dots of their life, you know, then you can contact the ACGP then as well, and they'll help you to think about how you might go forward. The other way I think in which churches can help is you can pray. You can be praying for this service, this kind of service,
very good.
For well-being and whole person care to really gain traction and you know, be something that succeeds right across the board. So you can commit to praying. You can commit perhaps to praying specifically for chaplains that who you know or you've met in your area. Pray for me and my colleague and my other colleagues around the country. And another way is you might want to think about giving. So you can, for example, a service like mine is only part funded by the NHS. You might want to think, well, could we sponsor chaplains? Could we give, for example, to a charity like the one that employs me, or into work to develop whole person care? So there are various things that Christians can do, I think.
I think that's excellent, and it really does, provide, you know, some good advice and as to how Christians can engage with this whole area of work.
I think what we mustn't do is jump into thinking, oh, this is a great way to get the gospel into my practice. You know, what we're trying to do is respond compassionately and lovingly to people's needs, and to be like I said, I see myself to be in the place of Christ alongside somebody, and that can be whether or not they come to faith.
Yeah.
I just want to love them,
Yes.
and hear them and give them opportunity to close that gap if they can.
Yeah.
You know.
Yeah.
So,
Sure.
yeah.
Sure. Yeah. No. Fascinating. Well, thanks very much, Helen.
You're welcome.
We've covered a lot of ground, but it's been fascinating, and I think you've given us a lot of food for thought. Let's hope and pray that this chaplaincy work mushrooms and blossoms in the country.
Yeah.
And as you say, what a wonderful opportunity. You know, I always think the kingdom of God, isn't it? You know, it's
Absolutely.
influence for the kingdom. We are salt and light and leaven, and
Absolutely.
what a wonderful way of being able to do that.
Yeah.
And as you say, part of our well-being is the spiritual side as well as, and it's all integrated in.
It is, yeah. And thank you for having me. And, you know, I mean, it's probably come across, but I do love my job, you know, and I love the fact that there's this opportunity to serve patients who just need their whole selves to be honoured and respected and valued, and that's what Jesus does, you know. And it's just a great privilege to be in the work I'm in.
Yeah.
Thank you.
Thank you. Thank you.